15 minutes together today. Thank you, Mike, for remembering to press
No.
record. That's always we always forget that bit. It's wonderful that you've all joined with us. Thank you. And today we're going to be covering off a couple of items. The main part of our day is Martin, who I've just mentioned and described what he'll be talking with us about. Just to kick off, I'm just going to give a little bit of a project update. I usually provide these only at the Carers Lead Network meetings, so I know we've got many social prescribers with us today, but hopefully most of it will be applicable to you. I just think it's important to say thank you for all of the ways that you've supported us so far and give you an overview of where the project is up to. And we've also had very significant changes ourselves within the organisation. We were very fortunate in winning the contract from West Sussex Local Authority, County Council. However, there has been changes in our offering, which we are just starting to bed down at the moment. Those changes came into place on the 1st of April, but it takes time to mobilise a new contract. So we're delighted that we're still able to support carers in West Sussex, but there will be changes to our support and services, which Mike will give you a little overview of, but more information will come out over the coming weeks. So really, I just wanted to thank you all for your support in the first instance. We are exactly 1 year into this 2-year project, and we were saying, Caroline, myself and Mike, that it's wonderful that we have these touch points with you, because I feel like just over the course of the year, it's become really evident that you are engaging with us more, you're referring to us more, you're signposting to us more, and obviously that's from our point of view, it's really impactful for the carers that you're engaging with and those that can be supported by us also. And it's just great for us that you've all been so engaging and just willing to work with us. And we're excited about the next year that's coming. So Caroline or Mike, can you holler when you can actually see my screen?
Yeah, we can see it.
Yeah, I can see it.
That's it. That's full.
Brilliant. All right. Well, sorry for doing it like this, but we'll have to. So I just wanted to thank you for your support. In the last year, we've actually seen an 86% increase in referrals. Those that have either come directly from you or where the carer has told us they were signposted to us by their GP surgery. So that's just an incredible increase on this last 12 months compared to the previous 12 months. And I think, as I say, that's thanks to you for all of your efforts to engage with us and to make sure carers are identified and supported. That's meant that we've been able to support over 500 carers directly in this past year. And we've seen actually in the last quarter, so in the last 2 quarters, so from October last year, the numbers have taken a real leap. So we know that that figure will go up over the course of the rest of the project. But it just shows there's 502 carers supported to us, over half of which, if you think of that 86% increase, wouldn't have been supported were it not for the nature of this project. We've also been coming out, and I say it's the royal we, it's actually Mike and Caroline that have been meeting with lots of GP surgeries over the last 3 months as we've moved into this new arrangement where we come out and we do a little baseline review with you, and we think about where would you like to have our help to put some improvements in place around care identification support. And you've all been incredibly welcoming, and there's some excellent work that's underway as a result of that. And just from our conversations with you and from the baseline reviews and from some of the work we've done with you, this is only from a small sample. We know that at least 950 carers that were previously unknown to you guys have now been identified and added to your carer registers. So I think that's just excellent work. And finally, Caroline, she bangs the drum with the patient participation groups, and we've recruited 10 to champion carer issues as an ongoing development item in their meetings with their practice managers. So thank you for all of your support in our first year of this project. I just wanted to let you know what's coming up next. And I feel like we've talked about this a number of times, and it's been slightly delayed, more than slightly, because of the changes we've experienced ourselves as an organisation, and because of the nature of the new contract that we'll be delivering. And so we've had to update it with new materials, new literature, messaging that reflects the new contract. But it is very nearly ready to go. And on our primary care dedicated portal, which we will circulate to all of you I'm really hoping in the next 2 to 3 weeks, there will be the dedicated referral GP button, and you'll see at the bottom right here, Megan, I don't know if Megan's on the call today, but Megan's been really helpful with working with us around reassuring all primary care providers about referring through to us. So we have looked at your own data protection impact assessments, and we are working to make sure that our processes meet the requirements for your data protection impact assessment. So that's something that you could all adopt once we get sign off on that piece of work. Without that, you are still obviously welcome to refer to us via the GP referral button, or to continue signposting if that's what you're more comfortable doing. But that is underway, and this will be published in the next couple of weeks, fingers crossed, she says. On that is also the carer toolkit, and I've just added a couple of the screenshots behind here, and it just takes you through the very simple 6 steps to put in place basic good level identification and support for carers. We do try and make those steps as simple as possible, and in those we do add all of the kind of documents that you could download and adopt yourselves, so that you don't have to think about writing all of those things independently. That includes things like Facebook, website text, it includes things like HR carer policies, it includes posters, it includes the literature, it includes digiboard materials, it includes a carer protocol, it includes the registration process. So we've tried as much as possible to make it as simple as possible without giving too much information, but making sure there's all of the key steps in place to be able to enable you guys to be identifying carers and supporting them within your surgeries. And included in that is the Library of Online Care Awareness learning set. So every time we do one of these sessions, we record it if Mike remembers, as he has today, and then we upload that onto the carers, onto the primary care portal. So we already have 3 of those sessions on there, and this will be added after today. And then that means that if you're looking at any personal development for anyone else within your surgery, you can think about just which one would be the most relevant for them and sharing that with them, or using it for dedicated learning time. Similarly, and I'm just about to tell you this in a moment, we have developed an interactive 30 to 40 minute training awareness session, which is on a learning management system. And we're engaging with as many primary care networks and individual surgeries to consider including this in their mandatory training for any new staff. So that will launch in May. Again, we've had excellent involvement. I'm going to just skip. You've muted, Anna. So I'm just going to mention, you can see just here, this is again Megan, but we've actually had support from a GP, from a digital lead, from a practice nurse, from a carers lead, from a care coordinator, all thinking about what the individual roles are in identifying and supporting carers. And we've incorporated that level of understanding and learning into our LMS carer awareness training module, as well as what the NHS and the Care Quality Commission expect of GP surgeries, about the benefits of engaging with carers, and to feedback from them directly on what they would like and listening to what they say. So that's going to become live in May, and we would like to work with all of you to think about how you could just incorporate that into the mandatory training for your staff. Many of you, I've just mentioned the baseline reviews. We started those one-to-one GP support baseline reviews in January. Was it January or February of this year? And Mike and Caroline have had lots of face-to-face meetings with you on that work. And I've just popped at the bottom here just so you can see. And these things always look scary when they're in Word, but it's an informal chat. We just go through it maps directly across to the primary care toolkit that we've developed online. So it means that you can look at that independently from when you're with us, but it also means that we can align the support we give you to that online toolkit. So we go through with you in almost like a checklist format, but it is very informal chatting. You're already doing so much of the work, and it's wonderful getting to put as many yeses as we can, but also in those areas where it's a no, it just means that we know how we can support you, or you know how you would like us to support you. So we've had 12 of those already. Please get in touch with us after today if you would like to book one of those with us. But otherwise, we will be in touch with you because we are trying to reach all GP surgeries in West Sussex and see how we can support you. Now, many of you have fed back to us that you would like us to share with you the carers that we have registered with us that say that they are with you as a GP surgery. And we've had that feedback lots and lots of times from all of you. What we are unfortunately unable to do is because we've got thousands and thousands of carers registered with us, we're not able to retrospectively request that permission. But as part of our new contract, we are developing a new content management system. So essentially, in the same way as you've got EMIS and System 1, we are developing our own new content management system or client management system. And as part of that, we are exploring permissions to enable us to be able, when a new carer registers with us, to ask their permission to share their details with you. So I would just like to acknowledge that we've definitely taken on board the request and we are exploring how we can do that. And we get, hundreds of carers registering with us every month. So that if that is something that we are looking to enable us to be able to share that information with you with their permission. And obviously it's up to you how you receive that information in terms of whether or not you want to then follow up contact with them, but it enables you to be able to update your records accordingly. And nearly finally from me, it's a very big plea for your help, please, because we are at the end of year one for this project. We're really delighted with how it's going so far and for all of the support that you have shown us. What is tricky for us at this stage is to evidence the impact of our work. I did show, at the beginning some of the main highlights, but we would really like to see, we want to celebrate all wins, big and small, just everything that you guys have done in your own environments to be able to improve how you're identifying and supporting carers yourselves, and also how you're engaging with us. So to do that, we are going to send out an MS Form survey in the next probably week and a half, and it won't be incredibly long or incredibly in detail, but we would really value your support in replying to us so that we can capture some of the great work that you've been doing and so that we can evidence the impact of this work, because it's something we would like to see continue beyond the end of the project, should it be possible. And the last thing to let you know, if it allows me to, yes, is just to remind everybody that the Carers Leave Act, many of you may be carers yourselves, many people working within our organisation are carers, and many of you are carers leads, so it's something for you to think about talking with your HR department. But the Carers Leave Act did come into force on the 6th of April, so nearly a couple of weeks ago now, and that has entitled unpaid carers working in England and Wales and Scotland to be able to take up to, I think there it is, 5 days unpaid leave. From the moment that they begin being an employee with an organisation. This leave can be taken flexibly in half and full days, and it's available from the first day of employment. And I've actually just linked to our carers leave, our carers policy for at Carers Support West Sussex, but that is an excellent example, I must say, of how carers can be supported. But I've also added the link here to the Carers UK website just to remind you what the new rights for carers are, and for you within organisations yourselves to have a chat with your HR departments and make sure that you've got a policy in place that reflects the changes in law and the new rights of carers. Okay, so I'm going to stop sharing so I can see people's faces again, and we will circulate that directly after today. I'm conscious I've spoken for 20 minutes nearly, or 15 minutes. Has anybody got any questions on what I've shared there? No, fabulous. If any of you would like to speak with me independently about anything that we've covered, please do. Mike I'm going to now speak with you just to give you an overview of some of the changes for us organisationally. And we wanted to do this because we're aware so many of you are referring to us and signposting to us. So we just need to be aware of some of the language that's used, because there has been some of our services are no longer continuing. And then Mike will introduce Martin, who's going to speak with us for about half an hour on carers financial support available to carers, and then I will come back and we'll finish up with the poll that we always do at the end, which just helps us plan how we will operate going forward. So, Mike, if I could hand over to you, and I'll silence myself. Thank you.
Okay. Hi, everyone. I'll keep this as brief as possible, but it is important that you know about some of the changes that we're actually going through, and we're still going through at the moment as we sort of bedding in this new service contract that we've got with West Sussex County Council. One of the major changes that we've had to our service is that we're no longer able to offer our counselling service, which was really popular with carers. But that doesn't mean to say that the carers aren't going to be supported with other offers of emotional support. We've always offered that other emotional support, as in the listening ear, when people sort of like contact us. Changes, we still have our community locality teams across the county. For us, the major change for us within the service is we're a north and south team, but for yourselves, you're still able to refer into our service wherever you are in the county, and that would be picked up by a local team to where your surgery is based. We're still able to offer the carer support groups, and all that we're either going to be sort of some of the face-to-face ones starting up, or the online groups. We still offer the specialist wellbeing workers, so we have around mental health, learning disabilities, autism, drug and alcohol, and dementia. The response line, which we've been sort of referring to, or have sort of referred into in the past, has been renamed to the helpline, but again, that doesn't affect how you refer into us. We will still be able to pick up those referrals to support those carers. We aim to increase our digital offer to ensure the phone lines are freer for those who are not able to sort of, the carers that aren't able to access computers and the internet. Now, the hospital team, which is working in various hospitals amongst the county, they've merged with us at the primary care team, and we have now formed the health team. So we're getting used to sort of the changes there, but again, that doesn't really affect our roles. We're still going to be coming out to visit the surgeries, yeah, we carry on sort of looking forward to sort of working with everyone. And our offers around benefits, which includes advice and funds, wellbeing funds and support, will still continue. With some of the funding, like the Carers Health and Wellbeing funding, we just have to establish that there is a need, and there will be a light touch assessment for that for carers, maybe a carers assessment, and where possible, looking at sort of self-funding. But again, we are still offering those, that funding is available. And as I sort of said earlier, no changes to our existing referral processes, and please carry on sort of making your referrals. If you can make referrals on, through the portal referral form, then that will come directly sort of like to our helpline, and we can then pick them up sort of through the locality teams. That would be brilliant. Okay. That's enough from me, and I hope that was all helpful. And I shall now pass you over to Martin Yarde, who is our benefits guru, and he will sort of give you an overview of the support that's available. So over to you, Martin.
Okay, so here to talk about the benefit service that we offer, and the benefits available to carers, or give an overview of it at least. So as myself and Donna, I was taken on in 2021, my colleague Donna a couple of years later, and we do one-to-one benefit surgery appointments with carers who want this. We also do a number of learning and development program meetings, about 4 a year, which are on Zoom, where people can come a little bit like this and ask questions about benefits. But the main bread and butter of what we do is these carer benefit surgeries, where we give people an appointment. Generally can be anything from 15 minutes to half an hour, longer if needed. We can do follow-up appointments just to ensure that people are claiming all the benefits they're entitled to, both them and the carer. So it's the carer and the cared for person we look at. We also have a benefits webpage and benefits toolkit we can send out that's accessible to anyone. As I say, the benefits carer surgery benefit appointments are the main thing that we do. Generally, you can get an appointment with me or Donna in a couple of weeks usually. As I say, it's generally a benefit check to go through what benefits people are entitled to, check they're carrying what they need to. We can help with applications for PIP, DLA, disability living allowance, and attendance allowance. We can help people, we can give a limited service helping people fill in the forms, answer the questions on the forms. So that's something we do as part of that. And so say the average appointment, 15 to 30 minutes on the phone, generally what it takes. And it takes about, generally someone can get an appointment with me or Donna, so say within about a couple of weeks. It was going to 4 weeks plus when it was just me, so which is why we took on Donna. So we can usually see people fairly quickly. We can help, as well as with claiming benefits, we can help people with mandatory reconsideration and appeals if they've been turned down for benefits. But this particularly applies to PIP, personal independence payment, which is the one that people are most likely to be disallowed when they first apply for it. We can help people with the mandatory reconsideration and appeals process, which very often leads to that decision to disallow benefit being reversed and the person getting the benefit, the PIP or other benefit that they wanted. And it's most often PIP, it can be other benefits as well. So what I'd like to do is just now give you an overview for the next 20 minutes or so of the benefits available to carers. So there's quite a bit of information on the slides, but don't feel you have to take it all in or remember it. It's just an overview of what's available. So I just share this now, share my screen. And okay, just waiting for that a minute. So can everyone see the big display where it says Carers Support West Sussex for family and friend carers? And it says overview of carer benefits in blue. Is that visible to everyone?
Yes.
Yeah.
Okay. So so the benefits available to carers, the main ones are carers allowance, universal credit, pension guarantee credit, legacy benefits, which they're gradually being phased out, some other contribution-based, national insurance contribution-based benefits, and council tax reduction. So first of all, to the next slide, we look at the benefits the cared for person must be receiving in order for the carer to claim benefits as a carer. So if the carer is going to claim benefits on the basis of being a carer, then the cared for person needs to claim certain benefits. If the cared for person isn't getting those benefits, doesn't mean the carer can't claim benefit, but they would need to claim on the basis of low income, unemployment, being signed off sick, other circumstances, which can apply to them. But actually to claim benefits specifically for being an unpaid carer, then the person you're caring for has to be receiving PIP, as it says in the first bullet point, personal independence payment, the daily living component of that. There is also a mobility component, which doesn't really count for making you a benefit claimant as a carer. PIP daily living component, disability living allowance, middle or higher rate care component, or attendance allowance, either rate. The most common one that people are getting is attendance allowance. That's the biggest group of people cared for. Attendance allowance is for people who are retired, retirement age, pension age and over, lower or higher rate. Disability living allowance, DLA, is now claimed only by children as a new claim. It's only available to children, but lots of people still get it as adults. If they've been getting it for a certain amount of time, they can continue to get it. a lot will be asked to move over to PIP, the first one mentioned here, which is the disability benefit for working age people. Well, I say working age, they're age 16 plus. So children claiming disability living allowance are asked to go over to PIP when they reach 16. I do another training course where I give more details of another training session, that is like slide session, where I give more details of what PIP, DLA and attendance allowance involve and who's entitled. But over the brief overview that I've said is PIP, personal independence payment, is for people aged 16 plus who are disabled. DLA, disability living allowance, is now for new claimants. It's for children under 16, and attendance allowance for adults who are already over pension age when they claim. So these are non-means tested, and if a person has a certain level of disability, they can get these. So there are some, as it says in the fourth bullet point, some less common benefits. For example, constant attendance allowance for industrial or war disablement. We don't deal with them here. We don't deal with them very often. So we will help with those as well. But I tend not to give much details of those in a talk like this because they're quite rare. So the carer can also, as it says at the bottom, the carer can also claim these benefits too. There are websites for the entitlement conditions for all of these on gov.uk, which will be mentioned at the end. And there's nothing to stop the carer claiming any of these disability benefits and still being a carer and claiming benefits as a carer as well. Some people think, well, I'm getting disability benefit myself, I can't be a carer. They won't accept that, but that isn't the case. You can claim the benefits I'm now about to look at for carers, even if you yourself are disabled and getting a disability benefit. So that's the benefits the cared for needs to be receiving. They need to be, as it says in the top paragraph here, the cared for must be severely disabled in order for the carer to claim carer benefits or carer addition to benefits. So to be severely disabled, that terminology in the benefit system means that you're claiming one of these disability benefits mentioned below. So going on to the next slide. So carers allowance is the first benefit we look at for carers. Now that rate has just gone up. So I've just realised these rates have just changed. 76.75 a week is actually £81 a week now, 81.90 a week. It's a flat amount, all or nothing is paid. The carer must be caring for a severely disabled person. So the previous slide defines what that means. Someone in receipt generally of PIP, DLA or attendance allowance. 35 hours caring. You need to be caring for that person 35 hours a week or more. You need to be age 16 plus to claim carers allowance. There's no upper age limit, although it generally isn't worth claiming as a pensioner. Although we'll have a look at that later for how it applies to pensioners, but generally it isn't. You don't generally receive it if you're a pensioner, although it can help you get pension credit if you claim it as an underlying entitlement. We'll come back to that. You have to be earning less than £139 a week. That's now gone up to £151 a week take-home pay, net take-home pay. So you'll get this full amount of carers allowance that's just gone up from £76 to £81.90 a week if you're earning less than £151 a week. Previously 139, and you get the full amount of carers allowance or you don't get it. It's not like some of the benefits like universal credit I'll be mentioning in a minute that taper up and down. It's an all or nothing flat amount of now £81.90 a week. You have to be not in full-time education, so you have to be not studying for more than 21 hours or more a week, not subject to immigration control and pass the UK residence and presence test, and you have to be and also so the past presence residence test means you have to have lived in the UK 2 out of the last 3 years, and that applies to even British people who've lived abroad for a couple of years. You still have to have been in, or for however long you've been abroad, you have to have been back in the country for 2 out of the last 3 years. And in red at the bottom, it says partners' earnings, savings, occupational pensions don't affect carers allowance, but it normally stops once state pension is received. More about that a bit later. But you can claim this even if you have a partner who's got a well-paid job. You can claim it if you or your partner has an occupational pension. That doesn't affect it. State pension does, but occupational pension at whatever rate that you may be getting as an early person who's taken early retirement doesn't affect it. So it can be useful if you have a partner who's still working or who is earning, either still working, maybe you've given up work to care for someone and your partner's still working, or if whether you've got a partner or not, if you've got an occupational pension, you can still get this one. Okay. Universal credit. Having looked at carers allowance, we look at universal credit, which is a means tested benefit for working age people with under 16,000 savings or capital, and that's the same amount of savings whether you have a partner or not. Carers and others can claim it if not working or working but on a low income, so you can claim it alongside carers allowance or instead of it. So if you don't meet them, so if you do get carers allowance, you can claim this as a top up. If you don't meet the conditions for carers allowance, you can still possibly claim this. It includes housing costs for rent, which replaces housing benefit now for most people. If you're caring 35 hours or more a week for a severely disabled person, that's someone on PIP, DLA or attendance allowance, you can get a carer element. Again, this has just gone up to about 198. You don't need to have claimed carers allowance to get this. Tell universal credit you're a carer, and if you meet the other conditions, you will get universal credit. You can get this. It doesn't have a cut-off point for earnings as such, like carers allowance, which stops immediately if you earn more than £151 a week. Universal credit may pay you if you're earning, say, 200 a week. That's still a low income, but it does take into account as it says in the last bullet point, it does take into account your partner's earnings as well. So you may not get it for that reason. So we normally do a calculation just to see if people are likely to get universal credit, as it's more complicated. You can still get it if you are earning, if you're earning more than the carers allowance limit, but you may not get it because your partner's working and earning well. So we have a look at universal credit for anyone on low income. So then if you're over pension age, we look at pension credit guarantee. This is the main means tested benefit for pension age single people and couples. Don't look at the figures they've just been updated. I do need to change those. It tops up a pensioner's income to a minimum amount, plus potentially a severe disability addition if the person is living alone and receiving attendance allowance, PIP or DLA. There's a carer addition, third bullet point. Again, I'm not going into huge detail about this because some of the figures are slightly out of date and it is only an overview. Carer addition of £42.75 a week. That I mentioned earlier that if you get carers allowance and you then become pension age, carers allowance stops if you're getting a state pension. But you can still have an underlying entitlement to carers allowance if that applies to you. If you're over pension age or getting a state pension, carers allowance you can't get, but if you apply for carers allowance, you can get this underlying entitlement to carers allowance, which can give you a carer addition to pension credit. Savings over £10,000 start to affect pension credit guarantee, but there's no automatic cut-off. It just is taken into account with all your other income. And normally with pension credit, both partners must be over pension age. Otherwise, if one's under pension age, one is over pension age, you need to claim universal credit instead. So universal credit still applies to you if one of you is under pension age, one is over. There are some exceptions to this. So most pensioners, majority of pensioners, single people or couple, find they've got an income too high to claim pension credit guarantee. You don't have to have a very high income not to be entitled to it. but it is worth looking at. We can check through to see if you might get pension credit guarantee, and the few people, say 1 in 20 or so, who do get it find they really need it generally. So it does apply to some pensioners. Then there's severe disability premium. I won't go through all the bullet points here as it is rather complicated. You have to be careful sometimes when advising people, because there's a severe disability premium or severe disability addition, as it's called, with pension credit that can be lost if you claim carers allowance for someone. So you have to just be careful that the person isn't receiving a benefit with a severe disability premium, which can be lost if you claim carers allowance for them. So I'm not going to go through all those bullet points as they're a little complicated, and I probably will amend that slide as it has probably a bit more than needed. But it's basically, to sum up, some people have a benefit with a severe disability premium, as it's called in certain older benefits, like ESA, or they have what's called a severe disability addition in pension credit, which can be lost if you claim carers allowance and if you receive carers allowance for claiming for them. There are some older benefits we advise on, still in payment to various people. They're being replaced gradually, being replaced by universal credit. Income related employment and support allowance is often received by people who've been unable to work for many years. They're often on that long term. That will eventually be replaced by universal credit, and that process is going on now. Income-based job seekers allowance is rarely seen now, so I won't mention that, go into that one. Income support is still received by quite a lot of people. This used to be the means tested benefit for carers and people signed off sick, gradually again being replaced by universal credit. Working and child tax credit is still received by quite a lot of people, again gradually being replaced by universal credit. And finally, housing benefit, and the final bullet point there, pensioners can still claim it if renting, plus some working age people if in temporary or special housing with disability support. So if you're a pensioner paying rent, we direct people to claim pension credit, but it doesn't apply to many working age people. Then there are 2 contribution-based benefits, which again, I won't go into all the details on the slide here, just to say that there is something called New Style Job Seekers Allowance, which people can claim if they have been, these contribution-based benefits are for people who've been working full-time or more or less full-time for the last 2 to 3 years and paying plenty of national insurance. They can get New Style Job Seekers Allowance, contribution-based Job Seekers Allowance, as it's sometimes called, if you've been employed rather than self-employed over the last 2 tax years. So some people who are carers will claim that instead, because they've just been made redundant, and they'll get more benefit from claiming that than claiming carers allowance. And this would apply if they're predominantly job seekers rather than carers. And the second one, New Style ESA, Employment and Support Allowance, you can get that if you've been employed or self-employed, and that one is available to people if they're signed off sick and paid enough national insurance. And these are not means tested as such, although occupational pensions can affect them. And generally, New Style Job Seekers Allowance is paid for 6 months, New Style Employment and Support Allowance for a year. It can sometimes be paid indefinitely. So they don't apply to a great number of people who we speak to. ESA, Employment Support Allowance, would apply to people who are maybe the person being cared for who's signed off sick, or perhaps the person who's the carer if they're predominantly signed off sick rather than a carer, because they'll get more benefit through these benefits if they apply to them than they will through carers allowance. Council tax reduction should be considered by anyone on low income. This benefit used to be called council tax benefit. Anyone on a low income should consider claiming it, carer or not. is not the same as the single adult discount of 25%, for which council tax 25% council tax discount, which any person living alone will get regardless of income. It is means tested. You have to have under 16,000 savings if you're working age. And when other benefits are claimed, for example, universal credit, DWP will often prompt you to claim it. And there are some other council tax discounts. Severe mental impairment SMI rebate mentioned at the bottom of the page there, which is for if people have Alzheimer's or learning disability and they have what's classed as a severe mental impairment, they can be removed from council tax liability completely. That's not means tested. And that tends to give the person living with you a 25% discount as if they were a single person. There's a student exemption and there's a carer exemption for an adult carer living with a disabled parent. So that's just a brief overview of council tax reduction. And finally, then there is a list of websites for any of the benefits mentioned in this presentation that can still be claimed. I haven't included there the legacy benefits, which only apply to people who are already getting them, that are gradually being phased out because you can't actually claim them anymore. You can only receive them if you're already getting them. So, but that is the websites, gov.uk websites for anyone, for any benefits that can still be claimed, which we've mentioned here. So I'm aware that looking at these slides, they're designed to explain a lot more about the entitlement conditions for the benefits. There are some details I may remove for future presentations because there is a lot of facts and figures that you're not going to remember those in a presentation like this. It's just to give you an idea of the kind of benefits that can be claimed and the different benefits you can claim, how they interact with each other. And to give you an overview of the kind of thing we deal with. And it actually only takes about 15 minutes generally to find out if people, when I talk to carers on the phone, whether they're entitled to any of these benefits or not, whether it's worth looking into that or whether they're actually not going to be entitled to any of them. So despite the complexity of the slides and the stuff I haven't gone into detail with there, it actually doesn't take very long in an appointment with a carer to advise them whether they and the person they're caring for can actually make a claim for benefit. If I'm helping them with the claim process, that obviously does take quite a bit longer. So, so that's an overview of the actual carer benefits. And I'm just going to stop sharing that. Stop sharing for now. We also, I don't really give much other financial advice. I know some of the basics about care costs, so can advise people about care costs, whether it's carers coming into the home or going into a care home, although I only have basic knowledge of that, whereas benefits I've got detailed knowledge and can usually answer you can usually answer any questions on benefits people we have. So how do we refer people to me? Basically, a person, what you do is the carer themselves usually rings the response line, or as the helpline as it's now called, and they ask for a benefits appointment, and someone on the helpline, talking to them on the helpline, basically books them in for an appointment with me. So it's done through the helpline on Carers Support. So carer rings in and they need to be registered with us if they're not already. That's quite a quick process, and then they can be booked in on the carer benefit calendar for an appointment, usually within a couple of weeks with myself or Donna, and I can go through then what the cared for, which they're caring for, can claim, check they're getting certain benefits, getting anything they are entitled to, or make a claim, start off a claim for anything they're entitled to. And then I also at the same time give the carer advice as to what they can claim as a carer, whether they can claim as a carer, or if the cared for person isn't entitled to DLA, PIP or attendance allowance, I can advise them just if they can claim anything on basis of being on a low income, or a job seeker, or being signed off sick. Okay. So I'd be very happy to answer any questions about benefits generally or the service we offer. I'm aware that some of those slides had a lot of information on, and it is only an overview. But I'd be very happy to open up any of those slides again in more detail or give answer other questions about the benefits themselves. Okay, Alexandra, you've got a question?
Hello, good morning. Thank you, Martin. I've got a couple of questions.
Yeah.
If I was to refer someone to you for attendance allowance, and you say
Yeah.
you start off the claim, so I'm aware that the claim is online, and lots of people that I come across are elderly and don't do online. So when you say that you help them, so you would basically start filling off the basic. I mean, it's like a 64-page form, isn't it?
So to answer your question, so attendance allowance isn't actually online as such. There is a website for it where you can look at the entitlement conditions and find the telephone number to ring up for the benefit. But to claim the benefit, you can either download the claim forms and print them out, or you can ring up and have the form sent to you. But in either case, the form isn't actually completed online. It is a paper form. So the best way to do it is to ring up for the form and have it sent to you. And then they will take the claim from the day you have rung up for the form, as opposed to downloading it from the internet when they'll only take it from the day they receive it from you. So it's best to ring up for the form. And basically what we do is a long form. We can give people a telephone appointment where we'll go through some of the questions. We may not have time or resources to go through the whole form, but we can spend up to about 40 minutes or an hour going through any questions they're finding difficult, and just give them an idea.
So to clarify, they are still filling the form out for themselves.
Yes.
But they've got you as a kind of I can't think of the word, to bounce off any questions like, I don't know what they mean by this, what do they want for that? That's
right. So I'll have a copy of the claim form up on my screen, and then I'll say, well, let's have a look at question 26, question 30, and I can give them an idea how to answer it.
Fantastic, because a lot of them are quite repetitive, aren't they? And they get confused because you think, well, I've put that over there, and so you might help and guide them saying, yes, I know that, but what you need to do is put it again or put it slightly differently.
Yeah, that absolutely, yes.
Okay, and they would still have to collate all the additional documentation and send it themselves.
That's right, yes. I mean,
so
sometimes
what if you have someone that can't do that, that is not capable of doing that? Is there
I mean, we only offer a service over the phone, so there aren't many people that applies to, but if that's the case, then they'd need to either get a family member to help them, or we would refer them to Citizens Advice or Age UK, who,
or
as far as I know, Citizens Advice and Age UK, as far as I know, can still offer face-to-face help with the forms, something we haven't really got the resources to do.
Okay. And the other question I wanted to thank you to ask is, like, I send a lot of referrals to you because I believe, I don't know whether this is actually true, for people who need help with long-term care planning. You know, in the fact that they're looking after someone and they just need to have someone to talk through and discuss what their options are, and to, you know, the idea of going and viewing care homes or looking at the care options, and then planning it financially. Is that actually something that you do? No, we just give advice on benefits. So not financial advice over care homes or care planning. It's purely benefits. I can give advice as to how those benefits will be affected if you go into a care home or into hospital. Can certainly do that, but not. I don't have any real training or experience in care planning or care costs. Just the basics. So is that I understand that's your role. Is that long-term care planning is not something that West Sussex Carers Support offer?
They don't really offer. No, not actual planning.
So if someone comes to West Sussex and that's what they need, where would you signpost them to?
So they would need to have a care needs assessment done by the council. So they can apply for that. and they also do the council also do a financial assessment.
Okay, and then that puts that again.
Alexandra, just to
Yeah.
say, in the context of all of this, so obviously Martin has spoken today about the way that we provide support around benefits advice specifically, and
yes, I understand. Sorry.
And in terms of referral, when you refer if you use that primary care button we mentioned earlier, if you signpost to our helpline, they identify the most immediate issue that's presenting, and that's when they'll be referred on to Martin if it's a benefits query. In terms of the broader support, that's what our Carers Support West Sussex advisors support the carer more holistically on, and that will include not us necessarily providing care planning, because that's not our role, that's the role of social services, but we will connect them with the appropriate people to enable them to get the care planning in place for the person with care needs. And what we do from the carers point of view is we provide something called a statutory carers assessment, which ties and connects in. So today we're looking specifically at how we can provide that benefits advice, but whenever we have someone referred to us, we wouldn't expect to deal only with the issues that are presenting around benefit support. That's when they connect to our service overall in terms of we do wellbeing conversations, and we make sure we don't provide support direct to the person with care needs, but we connect the carer and the person with care needs to the appropriate people to make sure that long-term planning is in place. So I know that doesn't provide detail, individual case by case, but that's where we work closely with social services. That's why we're funded by social services from this point of view. That's where our connections come from into social services around care planning and care needs assessments. So I just want to reassure you that we're looking at the holistic needs of the carer, not just the benefits. But obviously from our point of view, our focus is on the carer. So in terms of the services we provide, we're focused more on the well-being of the carer, the carer's needs assessments that present themselves, the benefits that the carer can access themselves, and then we connect them to the appropriate services teams, people, other charitable organisations, which I noticed some of them are coming up on the chat at the moment, around where the person with care needs will be able to have the appropriate and relevant conversations. So that's more what our community and locality teams do. We're so fortunate to have Martin with that very specific niche resource, because that's what a lot of carer support organisations don't commonly have. And then the rest of it is within our community teams about providing that wider community support and connecting them to the appropriate organisations for the person with care needs.
Yes, sorry, I didn't mean to hijack. It's just
no, that's fine.
I just wanted to clarify, because a lot of the stuff that you do, obviously I do. Yes, and I don't absolutely want to pass people on along a chain believing that they're going to get something when really I can just refer them to the people that you're referring them to.
That is absolutely right, Alexandra. And there's lots of duplication in terms of the role that a Carers Support West Sussex individual may be able to offer a carer, and the role that a social prescriber or a care coordinator might be able to offer a carer. We do cover some of that actually in the partnership section of our toolkit, because similarly Carers Health Team can do, but everyone's got very important and valuable things to add and to offer. I think what we endeavour to do, and which also you will endeavour to do, is that coordination function. So once we are able to offer the benefits advice direct to the carer, and we are able to offer the carer's assessment direct to the carer, which is statutory, and then we have those tentacles that connect to the other. So we try and provide a coordinating function. Yes. But you're right that you could do a lot of that independently yourself. So it's, from our point of view, what we want to ensure is that the person is accessing that support from the carer and the care needs point of view as quickly as possible, and that's coordinated with our partners. So I think it's really about conversations in those incidents.
Sorry, I didn't mean to hijack it. I just wanted to clarify to make sure I wasn't wasting
it's good for everyone.
Other people's time. That's all.
Yeah.
Thank you.
Thank you.
Okay.
Does anybody else have any other questions for Martin?
Just to say, before anyone is, one or two people are interested in having these slides from today. Absolutely fine. This PowerPoint can be sent. I will update the benefit figures because they have last year's figures have just changed. So I will update all those benefit figures on them before we send it out.
Brilliant.
Okay.
Thank you, Martin. So we will circulate those slides updated after today's session. Just to reiterate again, I mean, in terms of referring to Martin, you just refer to the overall organisation. So you use either the GP referral button, or you suggest themselves that they contact the helpline, or you refer using the currently professional carer referral button. So, and it will always find its way to Martin, and then they will access the wider support available from our organisation as well, which Mike highlighted earlier. So some of that broader support potentially around the equipment funding, the hardship funding, the support groups, the emotional groups, the carer wellbeing. We've also just about to launch something called a carer coaching programme, which is, I think, wonderful. And I am a qualified life coach myself, but that is looking at empowerment of the individual despite the situation and circumstances they find themselves in. And we've had some really early wonderful stories, so we will share some information on that in due course as well. So we focus very much today on benefits, but remember, it forms part of a holistic picture of support in partnership with our partners for carers and those they're supporting with care needs. And I think one of the most important messages, I suppose, is we appreciate that we know a lot of surgeries actually do try and open these conversations with carers around benefit, support and advice, and that can be from a social prescriber or care coordinator point of view, but it is very complex, and obviously giving advice is a tricky concept anyway, advice as opposed to having an informal conversation. So it's just really wonderful to have a resource such as Martin, and other some of them have been listed in the chat. What other resources might be available of a similar nature? So please just do make use of it if you're able to. Okay. So I'm just going to come back. We've had an hour together. We always allow an hour and 15 just for any questions that come out of a session like today, but also because we pop a poll at the end, because it helps us again just in terms of understanding if this has been useful and what future support you might find helpful from us. I just want to quickly revisit what Mike said. Also, we are obviously ourselves going through quite significant changes, and we've had lots of queries about updated literature. That is in the plan. We will be, our marketing team are currently putting all of those materials together, and then we will do a hard copy mail out to all of you of the updated literature for the organisation, for your notice boards. But in the meantime, we have just had the digital posters updated, so I'll be circulating those in the next week or so, or the links to those, so that you can print them out yourselves or use them on your digital boards. So I'd like to thank you all for joining us today. We look forward to seeing you again. We have these every 8 weeks, typically 7 to 8 weeks. So we'll look forward to seeing you again soon. We actually, the next one is in June, which will be in the middle of Carers Week. So we hope to, we're going to provide you with some materials in advance of that, actually, on some actions you could take around Carers Week. So it's a very big national, obviously, kind of highlighting an awareness opportunity for both carers that might not realise there are carers, and professionals that might not realise who carers are or how to support them. So we will be doing providing some materials in advance of that, and we look forward to meeting you in Carers Week and celebrating the day, celebrating carers, and focusing on a specific topic. What I'm going to try and do now, but you'll have noticed my PC is not playing ball this morning, is I'm going to try and launch the poll. If you have got time, please do take the time to fill it out for us. There's one thing on there that might not make sense unless I say this, which is as an organisation working with you independently, when we go out and do our one-to-ones with you, some feedback has been from surgeries that they would actually like, once they've put all of that in place, to have some sort of window sticker or plaque, something that acknowledges that they are, like they're a carer-friendly GP practice, and we want to facilitate that. So we're looking into funding that once the basic support is in place, a carer's lead badge for whoever that designated person is within the surgery, which would be a pin badge, and then either a window sticker or a plaque that actually acknowledges that the surgery is doing what they can to identify and support carers. But we don't know what it should say. So that is one of the poll questions, is what do you think would work best? And it would just be invaluable for us to have your feedback so that we don't make this stuff up ourselves, and it reflects what you think would be good for your organisation. So again, I'm just introducing that now, so when it comes across it, you understand what it refers to. Mike, yes?
Just last word from myself. Caroline and myself are contacting all the surgeries at the moment, so you may get emails from us or you might have had calls from us. Please, please, please do make time for us to pop out and see you, because we'd love to sort of see what you're doing in the surgeries and provide the support. If there's any support you need for identifying carers, we know you're all very busy and we appreciate that, but please respond to our emails or our calls. We are friendly and yeah, we're going to be quite busy hopefully, so see you all soon.
Thanks, Mike. And Petra, thank you.
Hi.
Hiya.
Sorry, Mike, as you've just said, identify carers. Can I have one quick question about carers as a whole? We have just realised that on the new NHS registration form, when we ask people to tick whether they are carers or not carers, it says, are you a carer, yes or no? It says what your relationship is with the person you are caring for, and then what type of a carer are you. So this is young carer, unpaid, but may get benefits, paid as a job, or foster carer. So actually we've realised that on our identification thing through the NHS registration, there is no distinction between the paid carer and unpaid carer.
I'll pick up on that with you. There is definitely a distinction, and there is a specific SNOMED code. And I think what they're doing is they're breaking that down to avoid the confusion. So what has definitely been confusing in the past, when we've worked with individual surgeries, we've recognised this, is that there are care workers included in the overall register for unpaid carers. So there is a very distinct and specific a specific code for an individual who is an unpaid carer, which would include a parent who is caring for a disabled child. It would include a young person who is caring for a brother or a parent. It will include an adult who is caring for another adult. So we can that is all included in the toolkit, but we can send that information out. What we can also do, which I haven't done, is find out the specific codes relating to a paid care worker. So that is a different, that will be something completely different. So in terms of NHS, in terms of the Care Quality Commission, and in terms of the SNOMED codes, there is a distinct code referring only to unpaid carers. And we're picking up separate conversations actually, or attempting to, with NHS England, because, and I'd love to see that form you've just referred to, because on the generic form, new patient form, there is an appropriate recognition of carers at the moment. So there is a veterans, which is a similar group, but there isn't currently of carers. So I'd love to, I'll pick up that conversation with you separately on that. But there is, I just want to reassure everybody, paid care workers are definitely distinct and separate from unpaid carers who have their own SNOMED code and an entire body of support and and policy that sits around them uniquely. So just to clear that one up. Okay, is there any other questions? No, fab. All right, thank you so much, guys. And I'm going to launch this poll. Please do take the time to do it. Please work. Hold a sec and launch. Please take the time. It doesn't take long. And when you're finished, please feel free. Can I just check, Mike and Caroline, can you see that? Yes, great. When you're finished, please feel free to exit the meeting, and we look forward to speaking and seeing you soon. And thanks again, Martin, for your time today. Much appreciated. Okay.
So, and I'll send you the updated slides in a few minutes, and you can then send it out to anyone who would like them.
Brilliant. Thank you so much, Martin.
Okay.
Thank you.
All right. Thank you.
Thank you all. I'm going to take my screen off now. Speak to you and see you soon.